Welcome everybody to today's TAC's Tic Talk. Today we have Dr. George Roth here to join us as a guest, and of course, always led up by our editor, Dr. Joe Bush from the American Chiropractor Magazine. Dr. Roth, thank you so much for joining us. Tell us a little bit about yourself. I know you're a regular author with the American Chiropractor as well as advertiser, so I wanted to give a little bit of background about what you do, and you're how many years young in practice on this subject that we're going to be talking today?
Right. This is my 46th year in practice, and some of the things I want to talk about go back to when I was still a student. And that now, as of this week, is 50 years ago. Actually, 50 years ago, last month. Yeah. So it goes back a ways. I started when I was 3 years old, so it's still, yeah.
Of course, that's the only explanation.
That's correct. Yeah.
And tell us where you're from, and of course, your educational background in a nutshell, and what we want to talk about today.
Right. Okay. Well, my educational background is I have a bachelor's degree in science from University of Toronto. I did my chiropractic training at CMCC in Toronto, and I went on to naturopathic college also in Toronto. And then I spent a number of years training in osteopathic medicine as well. And since then, I've tried to look at all of these different theories and put them together in a sort of a usable form that made more sense to me in terms of the science as I was looking at it from a very long time ago. And I hoped that I can share that with your audience today.
Mm-hmm. Great. Let me see here now. We've got today's topic is?
Well, today's topic is looking north of C1. It's an article I wrote that I think came out probably either early this year or late last year. And I was looking at issues in terms of us as chiropractors looking at the nervous system. And a long time ago, probably in the 80s, I began exploring the cranium and really speculating as to how we as chiropractors could address this area as well to make a more comprehensive program to address the entire nervous system. And I felt there was a missing piece that I really wanted to explore further, which I did, and then developed some techniques that I think I can share with other chiropractors. And many chiropractors are now looking at this process that I've been working on for the last over 30 years to provide this way of addressing concussions and traumatic brain injury.
Well, without a doubt, the issue of concussion and traumatic brain injury now more than ever is more prevalent in society. The information is growing. So how have you approached your technique and modifying your technique around the emerging information that we're seeing, say, out of the NFL, children's leagues for soccer? Mm-hmm. Can you just talk on those points a little bit and the assessment?
Yeah, let me give you a little background though, because I want to share just my first encounter at the Chiropractic College in Toronto. And I walked into the school because I was debating whether or not to explore chiropractic. And my first foray led me to the anatomy lab. And I met an amazing chiropractic student named Tom Hill, he was a great influence on me. And he was dissecting, I forget which part of the anatomy, but he was looking at that. And I was just fascinated by the intricacy of anatomy and really got excited about, looking at how anatomy relates to health and disease and how we can really look at the body in greater depth. And I figured, well, the best way for me to do that would be to teach dissection. So I actually got very strongly involved in that, even within my first month at the chiropractic school, in assisting in the anatomy lab, and then ultimately teaching dissection for about 3 years after my first year. And so that for me was a wake-up call, because I started looking at anatomy very differently. And one of the things that I discovered, I'm not sure why and how, but I started noticing on x-rays and in the anatomy lab that there were significant bone size differences on one side of the body versus the other. No one could explain that. I didn't know what to make of it. So I said, okay, I'm going to keep looking and explore, why this is happening, but also questioning anything that didn't have an objective basis for me. So I became fairly notorious at the college. I questioned the instructors regularly, and sometimes that was met with a little bit of stress, but at the end of the day, it developed a great rapport between me and some of the instructors in terms of really helping them to also look deeper into why they were saying what they were saying and how the chiropractic adjustment worked and things like that. So at the end of the day, I think it was win-win for everyone. But for me, I recognized that the body is probably very different than we were taught. And then as I explored osteopathic medicine, I began to look at different ways of doing things as well, and also in naturopathic medicine. And I really began to look at the body in terms of not just a physical form, but looking at it from a bioenergetic and bioelectric and quantum kind of perspective in terms of the kinds of things that we are applying to the body, whether it be manipulation or surgery or anything that we do from the point of view of medical care, how that can influence the body in a profound way to help it become more aligned, more support optimal health and so on. And so I kept on saying, well, if we're doing something that's changing things, we should have objective evidence for that. So that became my credo over many years. And I began to look at everything with that view. How can I actually measure changes other than subjective, improvement in, pain and so on, but objectively measuring changes. And so eventually I was able to figure out several methods that I combined from my chiropractic training, from my naturopathic background and osteopathy, to look at some more effective ways, let's say more efficient ways to address these issues and actually change structure in a profound way that kind of surprised me the first time it happened. So I'll just share a little bit of that on some of the slides. But I think one of the big areas that I looked at in terms of the nervous system was say, wait a sec, guys, how come we're not looking at one of the biggest centers of the nervous system, which lies above C1? Okay, it seemed like everything was stopping at about the occiput C1 level in chiropractic school. And I said, I think we're missing something. So I began to take different courses in cranial manipulation and so on with osteopaths and other people, and realized that there's another piece of the puzzle that we should be looking at in terms of addressing the entire body and, of course, the nervous system itself.
Well, that's amazing. Did I hear that you have some slides that you're going to be showing?
Yeah. So I'd like to go ahead and I'll start going through those. All right. So I'm going
for those who will then now be motivated to be, for sure, you may be listening. So you're going to have to describe the best you can, Dr. Roth, for everybody who may not have the video version of this.
Okay.
But for those who do, it'll make them want to access then the video.
Okay. So we are live as well. Is that what you're saying?
It's will be uploaded on YouTube, so they'll be able to find it on YouTube as well. Okay. But many may listen just simply on podcast versions.
Okay, very good. Oh, no problem. Okay, So, all right. So I'm going to just talk as if I'm talking to you on audio and as well. So the topic today is looking north of C1, which I think is really important when we're looking at the entire nervous system. And so what I'd like to talk about is the osseous structures that we are looking at, let's say in the spine, in the appendicular skeleton. If we move beyond that to the level of the cranium, the cranial base, we can recognize that there are significant aspects of our entire nervous system in the brainstem, the upper centers, the midbrain, the forebrain, and so on. These are all, of course, really significant. And what we may not recognize is that these are affected by structural injury all the time. And we see that in many sports, contact sports like football, hockey. Soccer is actually quite a significant one as well. But just common slip and falls. People are having injuries that affect these areas all the time. And I think if we look at the spine in combination with the cranium, we may actually be able to address many more issues here. So some of my early observations in looking at the skeleton as a student, and actually then when I began teaching dissection, is that there were significant differences in the size of the bone structure or the shape of bone structure on one side of the body versus the other. So for example, this is an actual picture of a skeleton. You can actually measure this. If you have a good skeleton that's cast from a real one or a real skeleton, you'll see these asymmetrical changes in, for example, here, the head of the humerus on one side versus the other. You can see here, in relation to that, there's a depression area here on the slide I'm showing, a depression on the left side of the rib cage. This actually indicates a very common injury of people falling onto their side where their arm impacts into the rib cage. The humerus changes its structure related to that. The rib cage does. And I'll show you some evidence that's been verified now scientifically to show that these bone changes are happening at a very microscopic level as well. You can see the length of the tibia on one side is significantly different. The thickness, etc., is often showing up. The width of the tibial proximal head and the femur. If you look at your own knees, you'll see if you check on one side versus the other, the head of the distal head of the femur and the patella may be larger on one side than the other. So these are the kinds of changes I noticed very early on. I said, what the heck's going on? So the question is, what are we actually made of? This framework that we're talking about, of course, is the deep structures of the bone, the skeletal framework in the body, subject to all these forces that happen through life on planet Earth, as I call it, falls on our knees, on our hips, on our arms, our hands, our head, our shoulders, and so on. All of these have repercussions. And when I started to recognize that there is this deep layer of fascia, bone is not what we thought it was. Bone is not a rigid substance. Bone is actually mineralized fascia. The bone that we're used to seeing is a cooked bone or a dry skeleton. Living bone is actually incredibly flexible. You can actually take a femur, a tibia from a fresh specimen and bend it up to 30 degrees before it'll actually break. So it has a lot of flexibility, a lot of resilience. It's a major source of shock absorbency for the body, but it is vulnerable to injury because it is more dense than many other tissues. So I refer to it as mineralized fascia. So now, when we look at forces entering a dense substance, if you have a dense material is basically something that has a lot more molecules per unit volume. And so when force enters a dense material, like if I knock on my desk here, you can hear that because the actual material inside the desk is very dense, and then it causes resonance through the air molecules that hits your eardrum. If you did the same thing on a pillow, you wouldn't hear that. So more force is absorbed the more dense the material it is. And so bone is incredibly dense, and so it will actually absorb many of the forces of injury, often due to impact, but even other stress, strain types of injuries. And so bone at the cellular level is something we didn't realize. This is something that was done by the team at University of California in 2005. So this is probably about over 10 years, almost 15 years after my theories I started to teach them. And they were able to verify using a very high-powered microscope, looking at bone during impact. And as bone was subjected to impact, it began to expand. The proteins began to expand significantly inside the bone. And after the impact, the bone remained larger than it was before impact. And this is verification of exactly what I had noticed how many years ago? 50 years ago. So, and so this research, and I've communicated with Dr. Hansman himself, and he basically has verified that no one has ever looked at this in terms of clinical application. And so this is why he's supporting this work by providing some of the graphics here from his research.
Mhm.
And so when we look at our skeletal framework, all the fascia and the muscles around it, and you recognize that inside here, there may be a bone that's now enlarged, the forces that places on the fascia, the stress and tension, changes the mechanics of the entire body. Everything in the body is responding to that. So pain, strain, restricted motion may actually be coming from some of these deep changes within the bone structure itself. So when we talk about subluxation, I want to ask you this question. Could it be a case of mistaken identity? So here's my evidence, okay? This is a model of actually a cast of a C1 vertebrae I'm showing on the screen. And if we look at it, we can see that on the right side, the articular process is actually significantly larger, 2 millimeters in every direction that you can see here. And this is something that if you looked at that and you palpated that and thought this was maybe a rotation or a translation, you might actually be misinterpreting what's really going on, because an enlarged an enlarged articular process will feel like it's rotated or translated. And the same thing you can see here in the lamina here. This is also showing an enlargement. In C2, from a similar skeleton, you see the same thing. On the right side, you have this expansion of the articular process that articulates with C1. The lamina is also expanded in all directions. So this is evidence that these bones are actually changing. And the question is, why? Were we born this way? And my contention is, and I'll show you evidence a little bit later, that no, because this can be reversed. And you're probably doing it with your adjustment and not really realizing that you're influencing these areas. So looking at other vertebrae, I'm showing a slide of a thoracic vertebrae with one side being much larger than the other. Same thing here with you see the transverse process and lamina on the left side here being much larger on one side than the other. And then you can even see it in the vertebral height. If you look at it from the anterior perspective, the enlarged transverse process on one side versus the other, the increased height of the vertebral body. And again, why is this going on? What does it represent? When we look at the cranium, we can actually see something quite significant too, because at the same time that the vertebrae may be changing shape, this also imposes significant stress, and it can go either way. A head injury can impose this force on the upper cervical spine, or the cervical injury coming up through the neck, trunk area up into the cranial base may impose a force that causes those changes as well in the articular process of the occiput. So what I'm showing here is the cranial base from below, and the occipital condyle being enlarged, and also just the cranium is expanded on that same side outward. This is a sign that there's been a change in the cranium itself due to some of the forces that have been exerted through it, either from the cranium or from the spine itself. And then we can see that same difference. If we look from behind, we see the expansion of the occipital prominence and expansion of the space between the foramen magnum and the mastoid process on one side versus the other. It's the same as this one on the other side. So there's a significant change in the structure of the cranium as a result. So let's talk a little bit about concussion and traumatic brain injury. As Dr. Bush was mentioning earlier, this is a major problem that we're dealing with on a population base that is affecting so many people, whether they know it or not. Anyone who's had a significant head injury has likely had some level of a concussion. And this is happening every 15 seconds in the US, for example. Every year, about 100,000 people die from traumatic brain injury, and 500,000 or more are permanently disabled. 80,000 people experience the onset of long-term disability following a severe brain injury annually, and approximately 5.3 million Americans, more than 2% of the US population, are living with a disability that results from a traumatic brain injury. The costs are astronomical. This is probably about a 10-year-old statistic that was estimated to be about $30 billion a year. Question is,
Yeah, that's definitely under projected, considering how it influences even like neurodegenerative conditions as we see that, right?
yeah.
So
And a lot of people don't connect that. Why? Some people are susceptible to neurodegeneration, cognitive changes, hearing deficits, visual changes. Many of these we can trace back to head injuries. And by literally correcting these, we see improvements in auditory function, visual function, measurable changes in neurological function on many, many levels, cognitive and so on. So, this is something we know we can influence. So, the question is, can we help? Yes, the answer is yes. But we have to recognize that it is something that is addressable through very conservative and gentle methods if we just look at it specifically in terms of what's really going on.
right. Well, the typical chiropractor, you mentioned gentle methods. I mean, if you get a post concussive syndrome in your clinic, you don't necessarily want to be doing very high velocity movements on the cervical spine. So, what kind of
Correct.
what kind of interventions do you
Yeah, I'm
propose?
going to talk about that very briefly momentarily. I will be talking about that, but the
Mhm.
approach can be extremely gentle but very profound in its effect. So I just want to address one more issue because there's another dense material in the body, which is the fluid-filled compartments, which are affected by injury, impact injuries, sports injuries, car accidents. The internal organs actually are very vulnerable to impact injury, and that can cause another layer of tension that expands outward into the rib cage, into the spine, into the pelvis, that change the biomechanics. So when we're looking at the spine and the pelvis and other parts of the skeleton, we have to recognize that in the trunk and also in the cranium, these are fluid-filled compartments that actually have a significant physical effect when they're impacted. All right? Because fluid, essentially water, is non-compressible, and when it's impacted, it will expand outward and therefore cause significant mechanical stresses on the skeletal framework in the cranium and in the trunk. This is something we look at very specifically. So let's look at the mechanism of cranial injury and how we can address it. So first of all, if we look at the cranium, we realize that it's very vulnerable. We have high center of gravity falling on our shoulder, falling on our head, even just falling on the shoulder or falling on the pelvis can cause forces to come up through the spine, causing forces to be generated upward into the cranial vault, which is a fluid-filled container as well. And so forces coming in directly can cause deformation of the skull, which I'll show you actual photographic evidence for. And then that force causes outward expansion of the fluid contents, which can accentuate this distortion in various ways, showing up as bulges or depressions in the cranium. And there actually was an old technique called phrenology where people would actually measure all the bumps on the head to find out more about this person. And I would say that there's probably something to that. These changes are actually often very asymmetrical and related to specific events that happened during life and during very specific injuries. And so these outward forces are combining with the inward incoming force, whether it's through the head or coming up through the cervical spine, that will impact upwards into the cranial vault as well. So one of the other pieces of the puzzle that's really important here, though, is recognizing that our body is interconnected in a system that we can refer to as biotensegrity. Biotensegrity is I give credit to Dr. Stephen Levin, who I've been coordinating with for over 30 years. He's an orthopedic surgeon who basically started looking at the body in a new way, recognizing some of the importance of the cellular research that was being done by people like Dr. Donald Ingber at Harvard, who's looking at the cellular level, how all of our cells have a geodesic framework inside that cause the cells to function in a certain way when forces are applied to them. And because in addition to that, we'll have a look at a couple of views of the cell. When we look at how everything in the cell is interconnected through this framework, we can actually see this in graphic representation. When we look at a very high-powered microscopic views of the cell, we can see this protein framework, which is actually a combination of actin and myosin and other proteins that are inside the cell. These are filaments and tubules that determine the shape of the cell, but also determine how the organelles and all the metabolic processes occur within the cell. And evidence from Dr. Ingber, as I mentioned earlier, shows that by changing the mechanics of the cell, you change the physiology. It can cause abnormal cell development and even cell death. And so the other piece of the puzzle is the extracellular matrix, which is the interconnected fibrous framework between cells. So every cell in the body is linked to every other cell as a continuous fabric. I've talked about this in other articles, and this is where we come up with this concept of matrix repatterning, which is one of the ways that I've been dealing with this. And we call the source of tension a primary restriction. And that source is represented here by this. I'm showing a slide of the of human body, just a diagrammatic view, showing what happens when the femur is injured. Let's say a fall on the hip, it expands, but because of the extracellular matrix and the intracellular matrix, that force is transmitted throughout the body, causing mechanical changes in other areas like the neck, the shoulder, the spine, the knees, the ankle. All of these areas are going to be influenced. The body has to adapt to that to compensate for it. Those mechanical stresses that can then lead to strain and ultimate pain and dysfunction. And so a lot of times when we're looking at areas of pain, we may actually be mistaking the source of the pain as a problem, when if we could find a way to trace it back to the source, then we would be able to be much more effective in providing long-term improvement. So let's have a look at how it works here, if I can. One moment. Here we go. So we start off with this structural assessment, looking at what I discovered 50 years ago. Where are these bone changes occurring? And you can actually see this. If you start looking for it, you'll be amazed. The scapula on one side is bigger than the other. The clavicle, the knees, as I mentioned before, one knee being bigger than the other. The shoulder, the humeral head, the pelvis is actually going to be bigger on one side than the other. It's quite remarkable when you start looking at it. The shape of the spine, etc., and the cranium itself. All of these things can reflect where injury has been absorbed into the dense framework of the body, which then alters the mechanics of the articulations, the muscles, the fascia, the internal organs, and the nervous system, the cranium, and the spinal cord itself.
So we see this with like scoliosis, right?
Yeah.
Much more prominent to see that.
Yeah.
How can we make a positive change, and how long does something like that take?
Yeah, that can happen instantaneously. Those bone size changes I literally have witnessed on myself and others within minutes or less. You'll see a change. Wow. This is a quantum change in the tissue, which actually happens almost instantaneously in the protein framework. And that was what they discovered at the University of California. It's an instantaneous change, but often unrecognized. But these are measurable changes when you start looking at the size of these bone structures, one side compared to the other. And then with treatment, you can actually see these bones changing quite dramatically. It's quite profound. And for most people, when they first experience it, it's very unexpected. And something that I suspect chiropractors are doing without knowing it. They're actually, when they're treating the spine and other skeletal structures, they're actually influencing this. Okay. Now, one of the changes that I discovered many years ago is when the bone changes or the tissue changes, it changes its bioelectric properties, the way tissues conduct electricity, which is very significant. So if you look at cardiac issues, how do you measure it? It's an electrocardiogram. For the brain, it's an electroencephalogram, right? And you can do electromyogram. All of these things change electrical properties when they're affected by some form of dysfunction or disease. And so the same applies to structural changes. And this is something, I won't go into a long process here of explaining it, but you can look at our website to understand this. And so the bioelectric assessment can tell us about other sources of injury that may not be obvious from the surface. And so for that process, I developed a technology called an alternating polarity concentric magnet, which has been around for a long time. we developed it further. It produces a form of cascading bioelectric effect, which creates microcurrent, which can actually create a normalizing influence on tissue. And because of that, we can actually use it to diagnose areas of injury. And its effects on pain modulation and tissue repair have been verified by 4 double-blind studies. So we know it's having a powerful effect on the body. But we use it not only to detect these areas of injury but also to treat them. All right, along with
George, I've never seen that instrument. I think.
yeah,
Where do we get that?
yeah, that's something I can talk about afterwards. It's something that's available from us as well, something that you can use for home treatment. It's amazing. We've had people comment on using that for improving pain. We've seen bone changes that happen over time with it as well. So that's something that I will definitely talk about further. Okay.
Great.
Well, and I wanted to jump in and ask as well on the bone density issue. Is that going to be diagnosed through
Yeah.
X-ray?
Yes,
Yeah,
absolutely.
exactly.
I'll show you some X-rays of how
that's
can affect bone
the
density.
piezoelectric effect and all that stuff associated with the bone
Yeah, absolutely. That's
strengthening.
so. When we assess the body, we use this magnetic device. You can use your hands as well. It's not as effective, but it still will produce it. The hand produces a fairly significant amount of bioelectricity as well. A lot of nerve endings, so nerves produce electricity as well. That's why if you bump your elbow, your knee, first thing you're going to do is put your hand over it. It feels better, right? You're applying a normalizing field. That's one of my theories, is that's why we do it. Okay. So we assess the entire body using a part of the body because it's interconnected. We can actually feel, for example, here, when I place the magnet on this person's leg and it's an injured site, the tone in the tissue here actually softens. It relaxes a little bit. Okay. It's very similar to muscle testing in some ways, but it's a little bit less of a fudge factor. You don't have to worry about mechanics of a muscle test. This actually is a tissue test. But it's a very similar principle. All right. So people who did muscle testing were onto this, and I worked with a number of the old timers, for the people like Dan Gleason and people like that who worked with the original ones. Since they learned this process, they only use this going forward. They stop using muscle testing and are using this form of tissue testing now. Okay. But the scanner, the bioelectric magnet, really stimulates that in a profound way. So with treatment, we do the same thing. We apply the bioelectric influence, and then we specifically address each of the areas of deformity within the bone through gentle pressure. And believe it or not, these can change dramatically, in a very short period of time. Typically 1 to 3 minutes, we'll see many of these bones actually changing shape. It's just amazing. And it's really about applied bioelectricity, using circuitry and piezoelectricity to stimulate that effect. So we call that pressure containment. And entrainment refers to the bioelectric support that allows for normalization. This is applying treatment to the head. One of our practitioners in Minneapolis using it for cranial treatment. He's written an article for your publication as well. That's Andy Stella. And so the power of piezoelectricity, when you apply pressure, as you were mentioning, Dr. Bush, when you apply pressure to many tissues, bone has been actually very well studied in terms of its piezoelectric properties. But what we don't realize, when it's injured, the actual crystalline framework expands to the point where electrons cannot move through it. And then by applying gentle pressure, you can stimulate that current, believe it or not, and restore it back to this neutral state of balance. So you have a structure literally on the right side that's deformed on this diagram, and then applying pressure to it allows the electrons to flow and restores the normal crystalline shape and structure of that material. It's quite amazing. And bone is no different than other materials that have been tested. Things like ceramics and metals do the same thing. All right. So this is something that we just haven't realized. From the chiropractic point of view, what we're doing when we place our hands on an area, we are having a bioelectric effect as well as a mechanical effect. Okay? And they work.
Dr. Roth, this is so amazing because honestly, we talk about, even the benefits of all these types of like you mentioned, the kinesiology testing. But the problem is when the patient see it, it looks crazy. So when you have this technology that actually supports that what you're doing, then like you said, that's probably why it's not that they don't need the kinesiology, but the efficacy of being able to show somebody, that it's actually true.
Yeah.
That's, that's where the technology helps provide and prove to people that chiropractic truly does work. And it's not a whole faith and belief system. It's
Right.
actual science.
Yeah, that's right. And this is reproducible. In our training programs, we do double blind assessment, so that one practitioner does not know what the other person found. They do it independently. We have an incredibly high rate of intertester agreement with that as well. Whereas muscle testing, unfortunately, is subject to fatigability and the angulation of how you're testing the muscle. I found it was very challenging to implement that. Although I think it also
Between the different sides, just, I mean, the strength differences for one practitioner can be confusing.
Exactly. It's just the angulation and the fatigability are challenging. So for me, the key is objective outcomes. All right. So, okay, fine. You think you got the problem. Let's see what happens with treatment. If you can measure the changes, these are the things that we measure. For example, this is an example of a young lady. She was 15 years old when she was first introduced to this process called Matrix Repatterning. She had non-union of a fracture in her tibia that had been there for 5 years. 5 years. Totally unchanged. They used bone stimulators. They put a rod in eventually. This is what her tibia looked like. It was basically completely falling apart. They referred to it as fibrous dysplasia. It was becoming completely, it lost its integrity. All right. And that's what it looked like. And this is after 6 treatments with Matrix Repatterning, normal, healthy bone. I don't have the other slides here, but the rod has now been removed because it was actually poking out. It was causing discomfort. She's functioning for the first time, unassisted walking for the first time in 5 years after these treatments. And she's doing great. This is probably about 3 years ago. And she's just in great shape now. So this is what happens to bone when appropriate therapy is applied. It was incurable. And this was just after 6 treatments. Okay.
Amazing.
Yeah. And this is another example here of a young hockey player who was 15 years old as well, believe it or not, at the time. He was hobbling up the stairs. His parents noticed that he was really badly injured after a hockey game. And so because of a genetic condition, the orthopedic surgeons were very, very closely monitoring the bone size. So it's very tricky to get exact bone size on an x-ray unless you regulate that with very specific instrumentation. So they were monitoring him. And so basically, if you notice here, there's a collapse in the medial aspect on this diagram here on the x-ray. You can see a loss of the height of the medial joint space here. And this is, I think, 3 or 4 treatments later. All right. This is restoration of not only the medial joint space, but this is actual size of the bone. This was basically verified by the orthopedic surgeons, and this was after, I think, 3 or 4 treatments. They measured about a 5 millimeter change in the shape of the tibia and the femur by about 5 millimeters, and now he was flying up the stairs. His parents were amazed. And so when you restore joint space, you allow joints to heal. And cartilage, people have a mistaken idea of what cartilage is, okay, including the meniscus. Articular cartilage is a solid lubricant, but in a living state, we're not familiar with that. It's actually got the consistency, according to the orthopedic surgeons I work with, consistency of cooked egg white. It breaks down very, very quickly under pressure. It was constantly being reproduced. But if you have mechanical forces acting on it, this can be true in the spine, in any of the joints of the body. It's going to break down faster than it's being reproduced. But if you give it the space and you give it the mechanics to reduce the stress on the cartilage will regrow. That's been proven in other studies with rats where they artificially remove the cartilage, and within a month or so, it grew back, okay, without any other forces exerted on it. All right, so we know this is possible. All right, and this is why this young man was able to continue his hockey career. Okay,
amazing.
Yeah. So other ways we've been measuring now, going back to concussion, we were involved with the University of North Carolina, researchers there who developed a device called the brain gauge. And they actually worked with us over a number of years, going back to, I think, the early 2000s when we started investigating concussion. And basically, it's the first high precision tactile biofeedback device that was implemented. And so, based on their results, based on what we provided them, this is showing their input from the device prior to treatment. And then this is just after one treatment. Okay, normalization of all of those levels of function in different areas of the brain according to their testing. This is independently tested before and after treatment. Okay, and they saw this consistently. And this is a comment from Dr. Tomerdahl of the University of North Carolina. And looking at head injury, this is an evaluation of a 40-year-old patient who was involved in direct head trauma from a motor vehicle collision, 8 months post trauma, and light sensitivity, noise sensitivity, etc. And so, according to him, this is something that he was able to verify with his testing that we had actually improved dramatically with concussion. And it's the same principle. Treating the structure of the cranium and the spine is no different than treating the tibia that you saw in the other x-rays. Okay, and now what we're doing is using a new form of this is basically EEG type of device developed at the University of British Columbia. And so we've been measuring people pre and post treatment using this device. And so we're getting these readings from them in terms of the area. I'm showing a diagram here with a light green area in the center, which is the normal area of function. And prior to treatment is a blue line. You can see in this area that's outside of that normal reference range. After treatment, this is the reference range that shows up following treatment. And you can see this consistently from case to case. And we were still tracking this and trying to accumulate data, but this is actually measurable brain function according to the reference points that they have created at the University of British Columbia with Dr. Ryan Darby.
Is that like electromagnetic?
It's it's an EEG, so it's basically a cap with gel. So it's called a response evoked response EEG. So they're given visual stimuli and auditory stimuli during this exercise, and then it's measuring their brain's rapidity of response and the number of neurons that are firing in response to those stimuli. Okay. So this is why, to me, it's always been about objective evidence. So these are the things that we can constantly encourage our practitioners. Look at the ranges of motion, look at the neurological function, look at the things that you can measure structurally. These should be noticeably improved. This is an example of just one treatment. I had a patient who was showing an obvious sign of a depression injury. And what you can see on on this diagram, if you're looking at it visually, you'll see on the left side here is a depression of the orbit and the frontal bone on this side compared to the right. Okay. And this is literally just one treatment. Okay. Restoration of the orbital arch, the frontal bone, right? These are the kinds of changes we see all the time. And this is an obvious change in the shape of the skull. But again, it's amazing how quickly this can happen if you recognize, first of all, where the injury is and how to address it very specifically. We see a lot of babies now. This is another example of a young child born with dysostosis of the cranial vault, often due to issues within the pelvis during pregnancy or perinatally. All right. And these are children often who have neurological deficits. We're seeing a lot more of those on a regular basis. And this is literally one treatment. Okay. And this is improved shape of the skull, symmetry, and so on after one treatment. Okay. You see the difference in the shape here. And these are kids who are not crawling properly. They have torticollis, they have scoliosis. We see more and more of that now. And a lot of this is cranial, but also spinal injury in the womb or during delivery. And then, so this work was recognized by Dr. Norman Doidge in his recent book in 2016. His original book here called The Brain That Changes Itself. He's a leading brain researcher. And he heard about my work. I wrote a book many years ago that he read and was intrigued by. And so in his latest book, The Brain's Way of Healing. He talks about matrix repatterning, and his comments are, for example, that he views it prudent to have a matrix assessment after a blow to the head. And observing such cases, he followed me around for several years, and he said it should be routinely applied in hospital emergency departments. So this is something that is independently validated by people.
Mm-hmm.
This is what I'm looking for. I don't want to say, oh, this is the be all end all, but I'm saying we can do more as chiropractors to address these issues if we just had the tools to do it, right?
Well, heck, I've got his book in my waiting room. Anyone who's had a
Yeah.
brain impact
Mm-hmm.
Yeah,
should.
very important. Yeah, he's an amazing guy. So we've become good friends over the years. So the question is, why repattern? So we talk about repatterning, restoring the structure of the body. That's really what it's about. The matrix is about the cell structure and the extracellular matrix. So injuries basically change the shape of things so the puzzle pieces don't fit. And the idea
Mm-hmm.
here, that can disrupt intracellular communication and
Mm-hmm.
physiology in the cell. And some people have connected this to even like stem cell therapy. By restoring the shape, you restore that communication. And without that, the problems keep returning again and again. And so with matrix repatterning, we talk about restoring the ideal size and shape so that it can improve the intracellular communication, restore cell physiology, and so the puzzle pieces can fit, basically. So, and you don't have to work hard at this. This is something that the body will do once you know where to treat it and how to treat it. It's a very, very gentle approach. It's surprising. And so we actually tell people ahead of time when they're treated, this is very gentle, but be prepared because the profound changes are often disruptive. And they may feel wacky for a day or two after treatment because it's changing the entire physiology and the nervous system. And so they may feel activated, as we do in many other therapies, but this is surprising because it is so gentle. All right. So we've been able to help people with a wide range of conditions, which I've talked about in other articles that are written for you guys. And I'm going to talk more about this in upcoming articles. But this is an area that we've been able to help with so many different types of conditions. I work with dentists. Our programs, we have medical doctors, chiropractors, physical therapists, occupational therapists, amazing group of people who come together and share ideas. It's really exciting to be in the program. I love hearing from different professionals and their feedback, and everyone's looking at it. And so other things you might be surprised about, esophageal reflux, normalizing the rib cage and the thoracic spine to reduce stress on the diaphragm, reduces the actual stress on the lower esophageal hiatus, keep allowing the stomach to keep the acid where it belongs instead of fluxing back up into the esophagus. And another big one, urinary tract issues, the pelvic issues, erectile dysfunction, urinary incontinence. It's just amazing how much you can help people. Snoring and sleep apnea has been a big area that we've helped so many people with. We've gotten many people off of the CPAP, which is terribly annoying for many people, including their spouses, but there is a mechanical reason for many of these cases, and that can be addressed.
Well, we did have an article on that topic recently. Now, Dr. Roth, I mean, this is fascinating, right? And it's causing people to really rethink how they're conceptualizing the skeletal structure, the nervous system, and including electricity as a intervention, as an assessment tool as well. Now, are the therapies that you propose, is it a multimodal type therapy with manual as well as some electrical type devices?
So it's a basically the approach that I've been developing for a number of years, along with some of the other practitioners that I work with in close concert, is this technique called matrix repatterning. Now, many people do it on its own. Some people combine it with some adjustments or physical therapies, laser. You can use a pulse magnetic field therapy along with it. But in many cases, you don't need to do a lot more intervention. It can be supportive. But unless you fix the frames, like let's say you're driving in your car and you hit the curb really hard, and then you notice your gears are not changing properly, your steering is pulling to one side, the door doesn't close properly. You say, okay, well, let me go to the mechanic, and they're going to look at it. They're going to change out a couple of parts. They're going to put lubricant here and there. The next thing you know, something else is going wrong. and then the other problems keep returning. So I say, okay, go to the other mechanic across the road. I think he's got some different insights. He's going to put it up on the hoist and say, look, wait a sec, your frame is bent. There's no way these other areas are going to, the parts of your car are going to work properly until we fix that underlying problem in the frame of this car. And the frame of your body is your skeleton. And the spine, if you look at the areas of the body that are the most protected, it's the cranium and the spinal cord. All right. Everything else depends on the communication system. And as chiropractors, we need to go beyond C1 because guess what? These injuries also affect the head. And with a very gentle approach, the average chiropractor can learn this in a very short period of time to make a gentle correction that can have profound effects over a long period of time. And we've seen such remarkable recoveries. And this is why Dr. Deutsch has commented on it and why we're so excited to share this with other practitioners, because it is something that basically anyone can learn and everyone needs. Bottom line.
Fascinating. Jacqueline, now, Dr. Roth, we kind of bit off a bit more than we could chew with this one. I think we need to get CE credits for this because the amount of information that you supplied here was, I mean, not in the typical format, but I certainly appreciate it. We did do a deep dive here. Jacqueline, what are your thoughts on everything?
I just wanted to say thank you so much, Dr. Roth. Like Dr. Joe said, normally we shoot for at least like these bite-sized 30 minutes, but we had no idea when you showed up with slides and everything and your topic of concussion. You're like, I got topics. We're going to have to be looking to repeat. You got to get this in a written article format if we don't have it yet. I know your latest issue is in the August 2024 issue, The Science of Low Back Pain. Yeah. If I'm not mistaken, that's the latest article by Dr. Roth.
Most recent published article.
Yeah.
Yep. So everybody can look for that. And also I've mentioned too, because you are, of course, an amazing industry expert for us, which is why you're a contributing author, one of our star podcast interviewees with some of the most views and listens that we have out there. But they can look for you also and your advertisements in the upcoming issues, because I know you always are featuring kind of topics about looking north of C1, which is something you've definitely educated a lot on. Dr. Joe and I are both finding information that we didn't even know that you did. Wow. And, we've been reading your articles for years. I remember over 27 years ago, one of the first articles I ever read, it really drove home to me when you just talked about the concussion topics and even, in a slow car ride with the jerking motion, how that affects the water and the body.
But the assessment, Dr. Roth, is something that definitely I hope that you go into further in the future.
For sure.
I mean,
now, and as tools to do that. I appreciate the opportunity to share that. And by the way, there's some introductory courses coming up online. People don't have to travel. So we have one coming up it's pretty soon, November 9th and 10th, for anyone who's hearing this ahead of time. And there's another one on January 18th and 19th. So those are webinars you can attend. You get a tool, you get a little magnet as well you can actually practice with, and you can test it out for yourself. You'll be able to use it right away. And these are courses that are going to be streamed live during those 2 dates, November 9th and 10th, January 18th and 19th. If you go to matrixinstitute.net, you'll get a ton of information. There's videos showing the whole process. A lot of what I've talked about is there as well. You can review it. And we're excited to share it. This is something we just love sharing. We have a great team of practitioners from all over the world now. We have practitioners all throughout North America, Europe, Australia, New Zealand. We're
very exciting. Well, good.
I have a quick question, Joe, before you wrap it up. Yeah. Because I was thinking,
there's never a quick question from Jacqueline. The listeners really always know that.
Yes. This is a good one because you talked about the kinesiology testing and this. Can you use your stuff to test yourself? Or the doctors be able to use it? Somebody like me who's not, I've always been too intimidated to ever learn the kinesiology stuff, but I want to learn this stuff for me.
Yes. Now, unfortunately, my first book is out of print. It was published in 2005, New Harbinger. It's called The Matrix Repatterning Program for Pain Relief. It may still be available in used forms. I'm coming out with a new book. Hopefully it'll be out. I'm hoping it's supposed to be out this fall, but it's kind of late right now. So we're still working on that. It's going to have a lot more self-help tools, things that you can do for yourself, for your family. And we're going to mount some more courses, first aid courses for the general public, so they can implement that, help their family members, and know when to refer to a practitioner like a chiropractor who's learned these techniques or other practitioners. And so it's a great win-win tool for people to be able to help themselves. Absolutely.
Amazing. Well, and then the patients will know when they actually do need to go to the doctor.
Absolutely.
All these diagnostic tools really help drive home. Nobody wants to have to go, but then you're like, oh, shoot. You don't want to wait till the wheels are off the car before you take it to the shop, right?
Yeah.
So,
and are these instruments, actually, the home version of that is available on our website as well. If you look under products, that's another website. It's called wellnesssystems.com, but you can actually purchase a home treatment kit. So that provides you with some of the magnets in like a home treatment version. And so those magnets actually are pretty powerful. If you look, I'll just show you a quick view of what the magnet looks like on the inside here. I'll put it up to the camera. That's what's inside the diagnostic kit. All right. It's a very powerful rare earth magnet that creates it's an alternating polarity. So north, south. Right? So those are fairly large and they're very powerful. It can't be used for a long time on the body. But then the home version is basically a miniature version of that. And those are encapsulated in specific discs that are applied then to straps that you can apply easily to any part of the body and help with chronic pain. It can help we recommend it for low back issues, for stimulating regeneration of the disc, for knee issues, chronic inflammation. We've had nothing but amazing response to that. And again, those are supported by 4 double-blind studies, including a more recent one in 2021 that showed improvement for period pain. Okay? Okay.
I was going to ask you about the research on all this stuff. Yeah. That was my next thing too. If you got any sources and all that to support it, we'll put them in the bio and include that along with this. So
I'll send that along to you for sure.
Thank you so much for joining us today.
My absolute pleasure. Thanks for the opportunity. Nice seeing you guys again. Take care.
Until next time.
All right.
Looking forward to seeing you in the upcoming issue of the American Chiropractor. Okay. Keep sending those articles and keep listening and keep watching. Thanks so much, Dr. Roth.
Take care. Bye-bye.